Hi everyone, my name is Ysabelle and I'm Bachelor of Science Population Health student at UCL. So basically our course is about public health, and there is a pandemic going on, which is COVID-19. So when the director of our program, Stephen, asked me if I could say something that will describe me in 3 words, I was kind of thrilled. I was doing a lot of things, which I will tell you in a bit. But then I didn't want to write a script about it because it changes every single day. What I do right now might not be what I do next week. So I believe that this will be very similar to a lot of people. There is this uncertainty in all of us, and that kind of does stem into a fear. But right now I feel like this is a time when we should talk about how we feel, what we do, and share with other people. And here it is, I'm sharing with you. Firstly, I'm a researcher. I was contracted to do work for the outbreak report for the Council Kent and Medway. Basically, this report talks about the action points, what will trigger the outbreak, what kind of threshold will count as outbreak in specific population. Maybe it could be a nursing home, it could be a prison facilities, it could be religious gatherings or any of the worship places. How are we going to control if there is a report of outbreak? What is the method of transport for allowing our students, school children, to get transition from studying at home to a school environment now? How are we going to transition retail shops? How are we going to transition restaurants to open to the public without jeopardizing their staffs and themselves? So this has been a core point of research I've been doing, and there has been other research I've been also working on as part of my my company, Assessor Global Health Ltd, which I've started work from QSTEM internship. Because I'm a data science pathway student, QSTEM is a way to learn about R and data analysis at UCL using the program R. And population health students can choose to go into this stream if they wanted to. And this allowed me to work on different data sets, looking at different correlation. So right now I've been looking at how Korean longitudinal aging study data can be found in the association of modifiable risk factors that usually stem during the midlife that affects dementia and cardiovascular diseases. So that has been my task for the week, looking at Cox regression using MCI, which is mild cognitive impairment, cutoff for the MMSE score, and the cutoff score for dementia, and looking at what kind of variables are have the highest hazard ratio. So secondly, I am a cyclist. I started taking up cycling just before the lockdown, and I've been happy ever since. I was very scared at the start, but living in Camden means I can utilize any of the Camden facilities or services that are provided for the Camden residents. Once I started taking cycling as a method of transport, I just use Santander bike, which is all around London. But then when I realized, okay, I want something to call mine, I bought a bicycle, and I was still a little bit scared of riding alone. So I took this one-to-one cycling session with Camden volunteer, who has been most helpful, taught me about how to look out, how to judge the road, who is at the way, where to look during the intersection. I learned everything. So it has been a great hobby of mine for now, and it has been the perfect method of transport that is also great for the environment. Lastly, I have been an advocate for BLM movement. BLM stands for Black Lives Matter, and it has been going on since forever. It has been in our history forever. And why do I care? Because firstly, it's human right to be equal to other ethnicity, and second of all, there is such thing as social determinants of health, and BAME population in the UK, which stands for Black, Asian, Minority Ethnic Groups, have been most affected by various, not just one, but various diseases, if not all. The statistic shows, except breast cancer, all diseases have social determinants of health as a cause of the gradient of health in the system. And even we're very, very blessed with this NHS, which is service for all. It might not be a service with equity because of the social structure, because some group of people may find it easier to get to those health services. Maybe it's easier for them to meet those appointments, and basically what we were taught throughout our year of university during our Bachelor of Science Population Health. There you go.